Brought to you by UC San Diego Health.
The cost of saving lives may have just gotten a lot more expensive. The Mylan Pharmaceutical Company just upped the price for an Epipen, which can stop a potentially life-threatening allergic reaction, from around $100 for a packet of 2 pens to up around $600. And joining us to talk about the impact of this price hike is Dr. Richard Chaffoo. Dr. Chaffoo, great to have you here.
Good to see you, Andrew.
This isn't the first time lately we've seen a potentially life-saving drug or device jump in price in a big way. Why is it happening this time?
Well, you know, there's a lot of theories behind this, Andrew. Of course, epinephrine is actually a hormone that's been around in medicine for a very long time. And these EpiPens have been around a long time as well. In fact, the company bought out the original company a few years ago, and then they did a lot of marketing, a lot of advertising, to where the Epipen now has the equivalent market brand as Kleenex does. And they really haven't changed the product, but they've obviously changed the price. And unfortunately, we know in America that 1 in 50 people will suffer some sort of an anaphylactic or life-threatening reaction that would benefit by the use of epinephrine. And the most common one, of course, as you said, is Epipen. And so no one's really sure why they have skyrocketed the price. Sometimes companies put a lot more money into research and development when they acquire a new company or a new product, and they pass that on to the consumer. But there's no evidence in the case of Epipen there's been significant changes. The company has admitted that they've donated about 650,000 EpiPens to about half the schools in the United States. But of course, still, there's a significant profit associated with it. I think last year the profit on it was like a $1.2 billion in sales.
Yeah,
so
and
it has to have something to do with it.
Right, and not only is this price going up, I mean, it's going up in a big way to the tune
Yes.
of 5 times or 6 times as much. Their competitor had a recall and kind of dropped out of the game. Is that part of why this is happening?
I think it is, Andrew. Part of that, there's another alternative product, Aquaquick, which is on the market. And it's a similar product. The problem is, Andrew, that the FDA has not allowed for a generic substitution of something like an EpiPen. So that has to be done on a state-to-state basis. Only about 21 states so far in the United States will allow use of some other product other than EpiPen. If the physician writes for EpiPen, then they would substitute a similar type product. But the majority of states, we still don't have that legislation.
Yeah, why would that
yet.
be the case? I mean, if, in a case like this where it affects thousands upon thousands of people,
Yes.
and certainly could save a lot of lives, especially young people's lives.
Yes.
Why would they not allow an alternative to be there, especially if cost could be the difference between saving a life or losing a life?
No, I totally agree. I mean, that's a great point. And there's really no way to understand why, because epinephrine is epinephrine. And the point is, it's a hormone that's used ubiquitously in medicine. It's really not an expensive drug. We use it a lot in emergency situations and hospital situations. Cardiac arrest, we use it in patients that have asthma or come in with croup as an inhalational agent. Of course, anaphylaxis, used in the public setting. So it's a little concerning as to why this hasn't happened, why we don't have more progressive legislation, and why, in fact, a product that really is not expensive to make and has been around in medicine literally for many, many decades is so expensive.
Asked a lot of questions here as to why exactly this is the case, and hopefully something is resolved, or at least there is another option for a generic that could be a lot more cost effective. Dr. Richard Chaffoo, we appreciate your time as always. Thank
Pleasure,
you.
Andrew.